cardiovascular pathology, cardiac tamponade. All right, so for cardiac tamponade, we already discussed it so many times in different pathologies, but what we need to know is that the definition is compression of the heart by fluid, whether it might be blood or effusions, okay? And that fluid is just going to be filling up the area between the heart and the pericardium, okay? And it's going to compress it, leading to an overall decrease in cardiac output, right? And that's one of the causes of our obstructive shock, which we already talked about earlier, okay? And since we have compression of the heart, right, that means that the heart can't fully relax, right? And since it can't fully relax, right, that connects us to the decrease in cardiac output because we can't fill the heart anymore. So we can't fill the heart because it can't fully relax. And then also we have an equilibrium of all diastolic pressures for all the four chambers due to the fact that we can't fully relax, okay? So since we can't fully relax due to the fluid in that area, it's going to equilibrize all the diastolic pressures for the chambers, for all the four chambers. Okay, next, you have to know the triad in which occurs for the cardiac tamponade. It's called the Beck's triad. This is the most helpful triad in this whole entire thing, okay? Out of all the symptoms, or out of all the systems, you have to know Beck's triad the most. It's so helpful, okay? And you're gonna see hypotension, distended neck veins, increased JVP, and distant heart sounds. They can give you two of them, they give you three of them, right? And they might say it in different types of ways, right? You have to know that. You're going to see hypotension due to the fact that you have a drop in cardiac output. You're going to see distended neck veins because, once again, since you're compressing the heart, it has no ability to relax. And since it can't relax, it can't get blood from the venous system. So the venous system has increased pressure. So that's where we get distended neck veins from. And then we get distant heart sounds because, as we know, the heart is now covered by a fluid layer, okay, between the pericardium and the heart. So when we go to listen to it, it sounds like it's distant because those beats of the heart have to travel through the fluid. So distant heart sounds, okay? Very important, Beck's triad, okay? On EKG, what are we going to see? We're going to see low voltage QRS with electrical alterance, okay? So what does that mean? We have low voltage QRS because, once again, the heart can't really fully relax, hence it can't fully constrict, okay? And so that means that we're going to have lower than normal QRS complexes because we don't have the full force and ability of that electrical ability to contract because we're kind of covered by this fluid. Okay, and we're also going to get electrical alterance. So what does that mean? It means the height of the QRS complexes are going to be different. They're going to be swinging. Okay, they call it swinging movement. Okay, and the reason behind that is because as the heart pumps, so let's say I constrict the heart, fluid now moves to a different area. Okay, and then once I relax and pump again, fluid will move to another area. So that causes the QRS complexes to have different voltages and different heights, and hence that's why we will see electrical alternance, also known as the swinging movement. Okay, so low voltage QRS with electrical alternance is going to be seen on EKG. Lastly, what do we see? We see pulsus paradoxus. Okay, pulsus paradoxus is a decrease, okay, in the systolic blood pressure by at least 10 millimeters of mercury during inspiration. Now, why does this matter? The reason this matters is because during inspiration, okay, the blood from our venous system fills our heart normally, okay? So normally when I inspire, more blood flows into my heart. That means I'm going to have more blood overall being pushed out of my heart, okay? So that means usually during inspiration, my systolic blood pressure rises, okay? However, in cardiac tamponade, I have pulsus paradoxus. It's a paradox. During inspiration, my systolic blood pressure actually drops because I'm unable to fill the heart, right? As we said, because that pressure is too high in the heart because of the surrounding fluid, okay? So it's very weird to see a drop in blood pressure by greater than 10 millimeters of mercury during systole on inspiration, because normally on inspiration, the blood should be filling the heart, okay? And that's known as pulsus paradoxus. And the way that they talk about pulsus paradoxus is very, very annoying. The way that they will say it, the way that they will present it in vignettes so that you don't know what they're talking about, okay? It can look like a loss of palpable pulses upon inspiration. That's one way they can say it. So upon inspiration, you lose palpable pulses. Well, what does that mean? Well, when I feel for a pulse, I'm feeling for systole. So if I lose that palpable pulse, that means systolic blood pressure has dropped during inspiration. That's one way they could say it. Okay? So just look out for that. There's so many different ways in which that they could say that you've lost systolic blood pressure by greater than 10 millimeters of mercury. All right? Now, pulsus paradoxus can be seen in multiple other pathologies, but I want you to be sure that you know that cardiac tamponade is one of the main ones you should know. Lastly, on x-ray or on imaging, you can see that cardiac tamponade can present with an enlargement of the cardiac silhouette, and that's just due to the fact that there's fluid now filling up that pericardial space, making it look larger. Okay? Lastly, a common cause of cardiac tamponade could be viral pericarditis. Okay? And we'll talk about pericarditis and how it kind of works with cardiac tamponade, but viral pericarditis can cause pericardial effusion, leading to cardiac tamponade. Okay? So let me just go over this high-yield, quick cardiac tamponade section. What you need to know is that it has fluid surrounding the heart, causing compression, leading to an inability for the heart to relax, which means that the heart can no longer fill. Okay? And that leads to a drop in cardiac output. It also causes that equilibration of diastolic pressures in all four chambers because I can't relax. I have to look out for Beck's triad, which is hypotension, distended neck veins, and distant heart sounds. And remember the reasoning for those. On EKG, I'm looking for low voltage QRS and electrical alternans, right? The swinging of the QRS. And lastly, I'm looking for the pulsus paradoxus, the drop in systolic blood pressure by greater than 10 millimeters of mercury during inspiration. Okay? So make sure you understand cardiac tamponade. And I think what everyone really struggles with is the differentiation between this and acute pericarditis or other pericarditis. And it's very easy. I'll get to that later.